All right. Where's the parathyroid located? Well, this is an awkward start.
On the thyroid, the side of the thyroid.
So where's the thyroid? Okay, so it's in your neck, y'all. Right here. Right here. In the middle.
Yeah, in the middle.
Just go like this. Cool. Okay. So the thyroid is here and the parathyroid is behind it. They have two totally different functions. They just have to just live next to each other. Okay. They shouldn't even call it parathyroid. It should be called something totally different. Yeah, they are wildly different. Nothing is the same. Okay. So the parathyroid's job is number one job. What is it? If you only had to pick one job, it regulates what? Calcium and phosphorus. It's going to regulate calcium, phosphorus, which also go on a seesaw in the parathyroid. Okay. So every electrolyte in different body systems will go on a different seesaw. And I do go over that in the fluid electrolytes playlist. It will change your life if you can learn them, because you will never have to memorize hyper again, because you'll already know your seesaws. Do you understand what I'm saying? Mm-hmm. For instance, if I know that hypoparathyroidism causes hypocalcemia, I know they have hypocalcemia and hyperphosphatemia. Know your seesaws. They will change your life. Okay. So this weekend, y'all need to spend some time with me, but not personally. Okay. I'm telling you, the fluid electrolytes will be vital to understand this. Yes, we're doing a lot of electrolytes today. Okay. I was going to have y'all do it before, but then I was like, yeah, that's a lot of work. So I'll have y'all do that at your own pace, but basically you have to start like today because you have a test on Thursday. Okay. So the parathyroid lives here. It has one job, and that is to regulate calcium and phosphorus. Okay. There is a hormone that it releases in order to regulate calcium and phosphorus, and it is called the parathyroid hormone. Thank God. In nursing school, it's never that easy. Okay. So here's what happens. You have calcium, and we have calcium in lots of different places, but for this purpose, you have calcium in the bloodstream, which is basically, we're going back to this. You have calcium that lives in here, right? Mm-hmm. And then you also have calcium that lives in the bone. Sorry, but it looks like a giant penis. Okay. We know that calcium makes up most of our bone, right? Okay. So its job is to regulate that. It will regulate the calcium better, and the phosphorus will follow it because it's a seesaw. Okay. Do you understand what I mean? Okay. So for instance, if your calcium blood level falls low, parathyroid hormone will be released, because your parathyroid will be like, I had one job. It's to regulate the calcium. Calcium's low. So it's going to go into your bone, grab all the calcium, and put it in your blood. Now your blood's normal, but who's suffering? Your bone. Exactly. Okay. Do we understand what the parathyroid hormone does? Okay. Is this mine? Yes. Okay. I should make sure. All right. So do you understand what the parathyroid hormone does? It has little fingers all the time through your blood. It's like, how much calcium do you have? And then if it goes low, what does it do? It goes and takes calcium from the bone and puts it in the blood, and then your bones will just fall apart. But it's like, the blood's good though, right? Okay. That's all that this chart is showing you is, okay? Here's your bloodstream. You got calcium in there. If the calcium goes low, your parathyroid hormone is released, takes calcium out of the bone, puts it in the blood, okay? So now you have enough in the bloodstream. Also important to note is that your intestines are responsible for absorbing calcium. So it will tell your intestines, like, you have calcium now, so you can absorb it and you can use it. What is calcium required to be absorbed, though? Calcium has to bind with something else to be absorbed. It can't be absorbed by itself. It can't be single. It's got to be married. It's a vitamin. Vitamin D. Yes. Vitamin D and calcium have to exist together for calcium to be absorbed. Okay. So on top of the parathyroid hormone grabbing the calcium out of the, putting it in the, and telling your intestines, absorb calcium, there's calcium there. I can't absorb calcium by itself. So they have to tell your kidneys to activate vitamin D. Okay. Once the kidneys activate your vitamin D, then your intestines can absorb the calcium and everybody's happy. Does that make sense? Yeah. All right. That's the job of the parathyroid hormone. You with me? Okay. Now let's go to what happens when this hormone is not acting correctly. Okay. Okay. All right. From here on out in endo, everything is going to be hypo versus hyper. They'll all look like this. And I usually do one disease per chart, but because these compare and contrast, I thought it was important to put them next to each other. Okay. From here on out, I will tell you what the hypo and the hyper match. Each one of these will match something other than just the hormone, because obviously it matches that. Okay, let me show you what I mean. Hypoparathyroidism. What does hypo mean? Low. So in this case, obviously it's low parathyroid hormone. That's a given. But in this disease process, in this one, this whole page, the hypo also matches your calcium. So if you have hypoparathyroidism, you can automatically know you have hypocalcemia. Okay. Do y'all know what the signs of hypocalcemia look like? So they're tight. Everything is tight. Hypocalcemia, tight, tight, tight. And I go over this in the fluid electrolytes. I'll go into it in much more detail because we don't have time to go into all the details on fluid electrolytes. But just remember hypocalcemia, tight. Hypocalcemia, tight. Okay. So here's what happens. You're not releasing enough parathyroid hormone. So that means, is it going into the bone at all? No. Is it pulling any calcium from the bone into the blood? So your blood calcium would be low. Does that make sense? Okay. So that's why the hypo will match the calcium. And if you have hypocalcemia, then you know by seesaw, you're going to have hyperphosphatemia. Very good. Okay. And I drew a little seesaw for you just to remind you. Okay. Now in hypocalcemia, so the signs of hypoparathyroidism are the signs of hypocalcemia. That's what all of these are. Right? Seizures, cramps, paresthesias, numbness, chevosics, trousseaux, spasms, tetany. That's what the signs and symptoms are. But just to make sure y'all know what these words are. What is tetany? Tetany is tight muscles. What are spasms? Tight muscles. What is chevosics? You flick on their cheek. Chevosics, you flick on their cheek and their muscles spasm like this. So if you think they're winking at you, they're not. They're just having muscle spasms of their face. Okay. What is trousseaux? Yes. So you put a blood pressure cuff and you do it as tight as you can for 2 minutes, and their hands are going to cramp or spasm into a sign language T. Okay. For trousseaux. That's not really why it's named that. I made that up. All right. And then everything gets so tight and so cramped, they start seizing. What are paresthesias? Numbness and tingling. So if they say you have a patient that's been diagnosed with hypoparathyroidism and all of a sudden they say they can't feel their hands, what would you do? What do you think it is? Well, you have to check their calcium levels first. So the first thing you would do would be check calcium levels. And then the second thing, of course, would be to give calcium if we needed it, right? All right. So your big key word for calcium is muscle. I do this on the videos, but it's also a little bit of heart. Okay, because you know calcium and potassium go on a seesaw in the heart. Calcium, potassium are in the heart. So if your calcium goes low, your potassium will go high just in the heart. So that's why you don't see anything about potassium on here. But you may see dysrhythmias in this patient. Do you understand? Because calcium does muscle, and your heart is made up of muscle. Okay, all right. So how do we diagnose? So when y'all see from here on out on all of our disease sheets, you will see the patho. What's SSX? Signs and symptoms. DX is diagnosis, TX is treatment, and you got NC, nursing care. And this is how you want to be doing every single disease, and this is how I will do it for you. So when you go into the test, you should, before you go into test, you should be able to say, I could ask you, what's hyperparathyroidism? You're like, well, it's a disease of the parathyroid where you're secreting excess parathyroid hormone and it causes signs and symptoms like blah, blah, blah. And how do you diagnose it? Let me tell you. And this is what we use to treat it. And then here's the nursing care. And if you can explain that out like that before you go on a test, you're fine. That's all you need to know. All right. All right. So how do we diagnose hypoparathyroidism? Well, their parathyroid hormone levels would be low. Calcium levels would be low. Phosphorus levels would be high. This is easy. Yes. So how do we treat it? Anytime we ask you how to treat it and the nursing care, you're going to go back and fix your signs and symptoms. What was the big sign and symptom for hypoparathyroidism? Low calcium. So give them. Well, that was easy. Calcium. Okay. And then we're going to give them a drug called but you also have to give them vitamin D. Calcium plus vitamin D because those are needed to be absorbed. Yes. And then you're going to give them a drug called Phoslo. Guess what Phoslo does? It lowers your phosphorus. Good job, everyone. Nailing it. Nailing it. All right. So nursing care. We need to watch our PTH levels, calcium levels, phosphorus levels. And why am I doing an EKG? It can cause dysrhythmias. We're going to put them on a low phosphorus, high calcium diet, right? It is important to note that these patients cannot have dairy. Does anybody know why? What is the main source of calcium? If I was to tell you increase calcium, what would you pick? Dairy, right? But the main source of phosphorus is also dairy. So if you give them dairy, you will increase their calcium, right? But you're also going to increase their phosphorus, so they can't have dairy. And then we're going to give them calcium and vitamin D supplements, Yes? All right. Do we understand hypoparathyroidism? What is the hypo match? With hypocalcium, it matches calcium and it matches parathyroid hormone, right? All right. Hyperparathyroidism. So what is hyper? Too much. Okay. Now for all of endo, I would say 99% of the time, the causes or the patho is going to be a tumor or trauma. What? Tumor or trauma. Trauma. It's just, yeah. Tumor or trauma. Okay. There's either going to be a tumor in the brain or you hit your head. Okay. So in hyperparathyroidism, there is increased PTH due to a tumor. Okay. So you've got tons of parathyroid hormone. What is it going to go do? Take all the calcium out of your bones and put it in your blood. So what's your blood calcium going to look like? Really high. What are your bones going to look like? Garbage. Okay. And if you have very high calcium, you will have very low phosphorus. And that's all your signs and symptoms. Look, hypercalcemia, hypophosphatemia, dysrhythmias, because calcium, what's the key word for calcium? Muscle and a little bit of heart. Okay. So if you look at the signs and symptoms of hypercalcemia, like weakness, constipation, right? And then if you have too much calcium, your body tries to get rid of it by gathering it all up in the blood and putting it together in a big giant stone. That's where kidney stones come from, is all your excess calcium gets bundled together in a stone. And then it's like, here's a gift to give to you, a nice kidney stone. Okay. Why would a patient with hyperparathyroidism cause osteoporosis and fractures? Yes, it pulled all the calcium out of the bone and now their bones are crap, right? Now, your kidneys don't normally get rid of calcium. Do y'all know what 3 electrolytes your kidneys normally get rid of? What do they help you get rid of? You could just guess electrolytes at this point. Potassium, sodium, and then the little forgotten one that nobody even knows about. Rhymes with schmoride. Yes, it is chloride. Those are the 3 the kidneys normally get rid of. But the kidneys are like a really good friend. And anytime you really need them to get rid of something, they will always come through for you. Okay. So in this case, since it doesn't normally get rid of calcium, but you got a ton, your kidneys are like, I will help you and get rid of this calcium. So that's why it says increased urine calcium. But your kidneys are not used to getting rid of calcium. So it can cause you to go into kidney failure. I mean, that's a good friend. It's taking a hit so much that it fails. Okay. Your body will always try to compensate. Sometimes it works and sometimes it just makes things worse. Okay. All right. So let's talk about how to diagnose hyperparathyroidism. So your parathyroid hormone would be high. Calcium would be high. So phosphorus would be low. Very good. Now we're going to do a parathyroid ultrasound and biopsy. What am I looking for? What does a biopsy look for? Tumor. A tumor. Because these endocrine disorders are either tumor or trauma. Very good, everyone. All right, so how are we going to fix this problem? Well, let's give them phosphorus because their phosphorus is low, right? Biphosphonates are the osteoporosis drugs that we give. Okay, you haven't learned those yet, but that's what they're, and they end in dronate, D-R-O-N-A-T-E. Those drugs will end in dronate. Okay. That way, if they give you a select all that apply or something like a patient has hyperparathyroidism, which the following would use in treatment. Okay. Biphosphonate is the drug class. The drugs end in dronate. Does that make sense? Okay. Why would I give them furosemide? Do you know what furosemide is? It's Lasix. Do you know what Lasix is? It is a diuretic. What does a diuretic do? Other way. Makes you pee. It makes you pee. Diuretics make you pee. Now, why would I give a medicine that makes this patient pee? Yeah, it's going to help your kidneys get rid of the excess calcium. Okay. And if they're like, hey, your parathyroid will not settle down, so we're just going to cut it out. Sounds stupid, doesn't it? Okay, but they may get a parathyroidectomy. All right, so we need to watch their PTH levels, calcium, phosphorus, and then watch their EKG. That's the same as before. High. Now we got to switch the diet. Now you're going to be on a high phosphorus, low calcium diet, but you still can't have dairy, right? You would increase their fluids, fiber mobility. And here we call it FFM. Anytime you hear FFM, that's fluids, fiber mobility. And what's that's the care for? Who would we need to increase fluids, fiber, and mobility in? What's fiber? Okay, so what does fluids, fiber, and mobility help you do? Poop. Because these people are very constipated, right? Because remember with hypercalcemia, all your muscles are very weak and your gut stops moving very well, right? Why would we want to do weight-bearing exercises? How do we grow bone? You put weight on it, right? You put pressure on it. So weight-bearing exercises are one of the treatments for osteoporosis because the more weight that we put on it, the more it tells and signals our bones you need to grow and get bigger and get better. Does that make sense? All right. So what does your parathyroid do? Regulates calcium and phosphorus. What hormone does it produce? Parathyroid hormone, which is PTH. Okay. What is PTH's job? For reals? It goes into your bone, grabs the calcium and pulls it into the blood. Very good. The hypo and hypoparathyroidism matches two things. Number one, the calcium, I don't know why we both said it weird. The calcium and the PTH levels. Yes? Okay, what's your keyword for calcium? Muscle, a little bit of heart. Okay. And hypocalcemia, what's your keyword? Tight. Okay, everything is tight. So that means in hypercalcemia, everything is good. And that's really all you got to know. All right.